I'm Dr. Gregory Albert, board-certified plastic surgeon. Let's discuss male breast reduction. Gynecomastia is breast tissue in men. Men with this condition will avoid activities such as swimming, exercise, and sex to avoid exposing their chest. With a rather simple procedure, men feel liberated. They're able to take off their shirts and wear clothes more comfortably.
Dr. Albert offers complimentary consultations. Visit our office in Delray Beach. Call 877-3-ALBERT today.
Hi, I'm Dr. Kenneth Levine. Welcome back to Health Talk. We're seen on WIW19.com and UVerse Channel 19. I'm here with Dr. Anthony Pannozzo. Before I forget, it's important, where can our viewers find you? Tell us your location, your phone number, your website, and things like that.
Well, we're in Delray Beach, 16244 Military Trail, just south of Linton, and it's a small office there, and the phone number is 561-381-5800.
Do you have a website they can visit you on?
Just put my name in, Dr. Pannozzo, and you should get it.
You mentioned your son. Is your son practicing with you?
Yes, no, he practices, well, we practice together, but far apart. He's in Phoenix, and I'm over here.
Oh, so you don't get together too often, do you?
No, by phone every day.
Now, is it a solely office-based practice, or do you go in the hospital?
We don't need to go in the hospital. It's better off. It's more efficient in the office.
I understand.
Less help. You don't need a lot of.
I understand that 100%.
For sure.
My office is completely, my practice is completely office-based, and I like it that way. I'm very comfortable here. You mentioned a slight rise in blood sugar for diabetics. Are there any medical conditions that would prevent you from being able to treat a patient as you would want to?
No.
Okay. How about ages? Now, I'm interested in this. What's your youngest patient? And I assume there's no oldest patient. How young will you treat a patient?
I've treated a year-old and a 100-year-old.
Does your treatment vary with age?
No.
No.
The body's the same no matter what.
Okay.
Now, of course, with a growing person, take that into consideration. An elderly person, they have more scar tissue than a younger person. But essentially, the approach is the same because the body's the same for everybody.
You have to help me to understand this. You have a middle-aged guy who has chronic hip pain, and you identify the scar tissue in that one area, and you inject it for him. He's going to leave before that appointment is over, he's going to leave without pain. Now, he's had pain in his hip for 5-10 years.
Right.
What do you tell him? What can he anticipate?
Well, we want someone who's on that program to just go ahead and use it. Don't sit down, use it. When the pain is identifiable. In other words, he can say, "I'm hurting right here, doc," then come in. We'll analyze it on the fluoroscope and knock it out.
What about people who have arthritic changes in their joints?
Well, it's a joint capsule again. And it's scar tissue. So if it's a shoulder, we can isolate it down and shoot it right out. Same thing with the hip. Same thing with the knee.
So if I've seen radiographs, I've seen pictures of arthritic degenerative changes in joints. I've seen it in the jaw, and I'm sure it's elsewhere in the body. Are you saying that those defective joint, the physical structures that are eaten away, don't have to be changed?
Actually, they're not eaten away. The way we look at it is it's a positive response of the body to repair it. So you have to have an injury first.
Right.
And then you have a repair process that goes on. So you have inflammation, repair, stiffness, and pain after that.
Okay.
And laying down of calcium. And if you notice, where is all the calcium? It's in the ligament structure, which is bone-to-bone connector.
Okay. So you feel that there's no need for joint replacements?
Not at all.
Never ever?
Nope.
Really? So orthopedic surgeons are not your biggest fans?
No. I can guarantee that.
Right? Okay. Do you ever interact with other medical specialists?
Oh, once in a while, sure. But this kind of thing is so far out, though. It's in by itself. The only people who deal with pain is
neurologist,
neurosurgeon.
Right.
Neurologist doesn't even do it. They treat nerve diseases. And this is not a nerve disease.
Well, I got to tell you, this has been really fascinating for me. I want to come visit you in your office because I want to see somebody who walks in with pain and is able to walk out pain-free, and it's fascinating. Tony, thank you for coming in, and we'll see you again soon. It's Dr. Kenny Levine with Health Talk, and we'll see you next week. Thank you.